Welcome to the Healthy Choices Hub podcast, where we explore the latest in wellness, lifestyle, and smart health solutions. In today's episode, we're diving into innovative ways to manage bunion pain and how minimally invasive treatments can help you get back on your feet. Now, for you listening, particularly if you're a busy professional, why zero in on this specific topic?
Well, it's more common than you'd think.
Right. Bunion pain isn't just, a minor ache. It can be a real barrier. It impacts mobility, comfort. Even just wearing the right shoes for work can become a challenge.
Absolutely. It affects daily life, productivity, more than people realize.
This highlights an interesting shift. Traditional surgery often meant a significantly longer recovery.
A significant downtime, yeah. But these newer, minimally invasive techniques are emerging as a really strong alternative. They promise less pain, sure, but also a much quicker return to your schedule.
Right. So our mission here is pretty clear. We want to cut through all the details and pull out the really core insights. How do these advanced techniques actually work?
What are the real benefits?
Yes, what are the concrete benefits beyond the hype? We want to get straight to the value proposition for someone who's actually thinking about solutions for this. It's about understanding a modern, maybe more strategic approach.
Okay, so what really stands out is the precision involved.
Precision, how so?
Well, they describe using these advanced instruments, very specialized devices. It allows surgeons to correct the bone alignment through much, much smaller incisions.
Tiny.
Millimeters, yeah.
Yeah.
Compared to traditional open surgery, it's a huge difference. And that means much less trauma to all the surrounding tissues.
Okay, so it's like a targeted approach rather than, a broader intervention. And these precise cuts combined with state-of-the-art fixation, like tiny internal screws or plates.
That's right, holding the corrected bone firmly in place. This internal stability is really key.
And that stability leads directly to faster healing and less pain afterward.
That seems to be the connection, yes.
Yeah.
Less discomfort post-op is a major theme.
Yeah. So translating that, the benefits for someone listening become quite tangible.
Very clear. Many patients experience rapid pain relief, sometimes almost immediately because the underlying mechanical problem is fixed.
Okay, immediate relief is compelling.
And what's particularly interesting for active people, or those needing to be on their feet, is the potential for much earlier weight bearing.
Really? How early?
Patients often start to bear weight within days, not the weeks or even months sometimes seen with older methods. That's where you see reduced downtime really making a difference in getting back to life.
That's the critical part, isn't it? The speed and efficiency. Less time recovering, more time doing what you need to do.
And it's not just about speed. There could be potentially reduced risks, things like infection or major swelling, because there's just less tissue disruption overall.
Makes sense. Less invasive, fewer complications.
Plus, by preserving more of the foot's natural structure, there might be a lower risk of long-term issues like stiffness or changes in how you walk.
So it's not just a quick fix. It's potentially better for long-term function, too. A strategic move for foot health.
But there's an important point here. As with any specialized procedure, expertise is the most important.
Okay. So it sounds great, but how do you make sure you get these results?
Right. Choosing a surgeon who is highly experienced, specifically in these minimally invasive techniques, seems crucial. It's not just any foot surgeon.
Experience matters.
Definitely. A skilled specialist does more than just the surgery. They do a thorough evaluation first, making sure this approach is actually the right fit for you.
Tailoring it to the individual.
Exactly. Tailoring the correction to your specific foot anatomy. It's about finding the right expert to assure the fix is effective and sustainable long-term.
So strategic selection, again, the right technique and the right practitioner, a customized plan.
And also, it's not just down to the surgeon.
The patient's role.
Yes. Comprehensive post-op care is vital. Diligently following the instructions on weight bearing, the right footwear, doing the recommended exercises. It's essential for healing properly and preventing problems down the road.
Makes sense. It's a partnership for the best outcome.